Hello, how are you today?
Good, how are you?
Good. I'm Krystal. I'm going to be your student advanced practice registered nurse today, okay?
Nice to meet you.
If I can I ask you some questions about your health?
Of course.
Okay. Have you ever been hospitalized for any reason?
No.
No? Okay. What about any surgical history? Have you ever had surgery?
No.
No? Okay. What about your mental health? Have you ever been told you have anxiety, depression?
I do have anxiety.
Okay. Any major childhood illnesses?
No.
No? Okay. What about adult illnesses?
No.
No? Have you ever been seriously injured?
No.
Okay. What about immunizations? Are you up to date?
Yes.
Have you had a flu shot?
Yes.
Good. Do you currently take any medications?
No.
No. Over the counter?
No.
No. Okay. What about allergies? Are you allergic to any foods, drugs, environmental allergies? No. Okay. Have you ever had a blood transfusion?
No.
No. What about your last menstrual period? Do you know when that was?
I'd say like September 5th.
September 5th. Okay. Are you up to date on your health screenings?
Yes.
When would you say your last health screening was?
About 6 months ago.
Okay. Do you have any cultural concerns
No.
when we go through this today? What about environmental? How's your home?
I think it's pretty safe.
Safe? You
Yeah.
feel safe at home?
Yeah.
Do you live with anyone?
My dog.
Dog. Okay. And what's your dog's name?
Bean.
Bean. What is your current occupation?
Nurse assistant.
Nurse assistant. Where do you work?
I work at the medical center.
Okay. Are you ever concerned about chemical exposures?
No.
No. Okay. What about your education? What's the last grade of school you completed?
2 years of college.
2 years of college. Are you married? Single?
Single.
Single. Okay. Do you use tobacco products?
No.
What about drugs or alcohol?
No.
No. Okay. What would you say your religious preference is?
Christian.
Christian? Okay. Do you have any concerns related to your health with your religious?
No.
Okay. What about nutrition? Would you say that you eat fairly healthy?
Yeah.
Yeah. What's a typical meal consist of for you?
Chicken and veggies and...
Oh, that's good. Do you exercise ever?
Occasionally.
Occasionally.
About 1 to 2 days a week.
Okay. And how long would you say that lasts, your exercise times?
Maybe like 30 minutes to an
Okay.
hour.
Do you feel like you get enough sleep?
Yes.
Okay, what's a typical night's sleep like for you?
About 8 hours.
8 hours? Good. Well, that's good. Especially being a college student.
Yeah.
Are you sexually active?
No.
No? Okay. Any concerns about your sexual health?
No.
Okay. Have you recently traveled anywhere?
No.
Okay. Any concerns about the your healthcare costs?
No.
No? Okay. Okay, now I'm going to go over some family history. First, I'm going to start with your siblings. Do you have any siblings?
I have 3.
3?
I have 2 sisters and a brother.
Okay. Any major illnesses in your...
One sister has anxiety.
Okay. But nothing in your other siblings?
No.
Good. What about your dad?
My dad has prostate cancer.
Okay. Any other health problems with him?
No. Not that I know
Okay. What about your mom?
of. She seems to be healthy.
Oh, good.
Nothing I know
Good. What about their siblings? Any major?
of. No.
No? Okay. What about your mother's parents?
My mother's mom has brain cancer.
Okay.
Dad was healthy.
And then what about your dad's parents?
My dad's dad had depression. Both of them had depression.
Okay. Good. Do you have any other questions for me before we begin the exam? Okay. Okay, I'm going to wash my hands. Okay. First, I'm going to begin by taking your vital signs.
All right.
Take your blood pressure. I palpate for the brachial pulse. Good. Could you hold that for me, please? Thank you. Good. 96/62. Is that about what your blood pressure runs?
Yeah.
Okay.
Pretty well.
Well, you're healthy and you exercise. Now I'm going to count your pulse. I've got the clock on the wall back here. I'm going to look at it. And move your tie, please. Thank you. Good. Your heart rate's 80 and your respiratory rate's 18. I'm going to mark that down. Good. Can you turn and face me, please? Thank you. Okay, I'm going to begin by inspecting your scalp and your skull. Feel for any abnormalities on the skull. Is that tender?
No.
Okay, I'm going to look at the hair. Okay, I'm going to look at your scalp in 3 places. Good. Good. And here's your hair tie if you'd like to.
Thank you.
Okay, and now I'm going to, after you get your hair up, I'm going to visualize the face. Good. And while I'm here, I'm going to test cranial nerve 7, which is the facial. I'm going to have you raise your eyebrows. Good. Can you close your eyes real tight? Good. Can you smile? Good. Frown. Good. Show me all your teeth. Good. And puff out your cheeks. Good. Okay. Now I'm going to examine your eyes. Okay. So if you would take this card for me and hold it out and read the lowest line that you can.
426739.
Good. Any difficulties there?
No.
Okay, now I'm going to visualize that. I'm going to have you raise your pointer fingers up for me. I'm going to come behind you and I want you to raise your finger when you see my fingers, okay? Good. 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 Now I'm going to inspect the eye. I'm going to begin by looking at the eyebrows. Looking at the distribution of hair. Can you close your eyes? I'm looking at the eyelids. Good. Open your eye for me. I'm going to now examine the lacrimal ducts. I'm going to touch your face. I'm going to look at the conjunctiva and sclera of the eye. Good. I'm going to take my light and I'm going to look at the cornea and lens. Good. Okay. I am now going to look at the iris, the color of the eye. And I'm going to look at the pupils for if they're round, equal. Okay, and now I'm going to test the reactivity of your pupils. So I'm going to look for the direct and indirect light response. Good. Okay, and now if you would look at my finger. Good, and now look at the wall behind me. Good, the pupils are reactive to light and accommodation. Now I'm going to test cranial nerves 3, 4, and 6, which are oculomotor, abducens, and trochlear in a different order. But if you'll follow my fingers. Good. Any pain with that?
No.
No. Okay. Now I'm going to examine your eye. I'm going to look for the optic disc, all the different vessels, and the macula. Okay, you can visualize those structures. Good. Okay, and whenever I tested your reading, that was cranial nerve 1, the optic nerve. Now I'm going to look at your ears. Looking at the auricle. Good, I'm going to palpate the tragus. Any tenderness?
No.
Okay, now I'm going to get my otoscope and I'm going to look in your ear. I'm going to look at the middle ear, eardrum, and ear canal. Pull the ear back. I'm visualizing the cone of light, the eardrum, and the malleus. I'm looking this ear. Sorry for my cord. Good. And I can see those same structures in this ear. Now I'm going to test your hearing, which is cranial nerve 8 auditory. Okay, I'm going to whisper some words in your opposite ear, so if you'll repeat those to me.
Dog, cat, bird.
Good.
Red, orange, yellow.
Good. No pain on your ears anywhere? Okay, good. Now I'm going to look at your nose. Look at the anterior and inferior nose. I'm going to take my light. I'm going to raise your nose up. Look at the nasal vestibule. Good. Now I'm going to attach my speculum. And I'm going to look in the nose for the inferior middle turbinates and the septum. Good. Here's where I would test cranial nerve 1 olfactory, but we're not going to test for that. Okay, now I'm going to look at your mouth. I'm going to inspect the lips. Good. Get my tongue blade here. And I'm just going to use my otoscope light. I'm going to have you open your mouth. I'm going to visualize your teeth, gums, your oral mucosa, and the hard palate of your mouth. Good. Lift your tongue up for me. Good. Now, can you stick your tongue out? Good. And can you touch each cheek? Good. That's cranial nerve 12 hypoglossal. And then can you take your tongue and touch the roof of your mouth? I'm going to visualize the bottom of the oral mucosa again. Good. Now can you say ah?
Ah.
Good. I'm looking at the pharyngeal area, the movement of the soft palate and the uvula. Good. And I would elicit the gag reflex, but I'm not going to. That's cranial nerve 9 and 10. And those are glossopharyngeal and the vagus nerve. Okay, now I'm going to inspect your neck. Good. Can you take your neck and tilt it back? Good. Forward, touch your chin to your chest. Can you look over each shoulder? Good. And touch each ear to each shoulder. Good. Now I'm going to feel for your all of your lymph nodes. I'm going to feel the occipital, posterior auricular, sternomastoid, preauricular, parotid, retropharyngeal, thyrolingual mastoid, submandibular, submental, sublingual, anterior cervical chain, internal jugular, and the posterior cervical chain. Good. And supraclavicular. Good. Now can you raise both arms for me? I'm going to visualize the armpits of both arms. Good. Okay. Lower your arm. I'm going to feel for lymph nodes. Good. Good. Now I'm going to go back to your trachea. Can you take a breath in for me? Good. Breathe out. Trachea appears midline. And visualize the thyroid gland. Put your head back a little for me. Good. Good. Come around behind you. I'm going to displace the trachea to palpate for the thyroid. So I'm going to go to the left, to the right. Good. Any pain there?
No.
Okay. Is it okay if I raise your shirt?
Yes.
Okay. All right. I'm examining the posterior chest. I am going to look at the cervical, lumbar, and thoracic spine. I'm going to palpate those for tenderness. Let me know if you feel anything. Okay. Actually, could you turn around for me on this table, please?
Like this?
All the way, please. Thank you. We'll raise your shirt back up. Good. So no tenderness on the spine?
No.
Okay. I'm going to palpate for CVA tenderness. So if you feel any tenderness, let me know. No? Good. I'm going to go about the 10th intercostal space. Take a deep breath for me. Good. Lung expansion appeared to be equal. I'm going to percuss. No tenderness?
No.
Okay, I'm going to ask you to take some breaths through an open mouth for me, and I'm going to listen to your lungs. I apologize. Good. Now we'll lower your shirt back down. Okay, and if you could twist around this side of the table for me. Thank you. Okay, now can you raise your shirt up for me? Okay, I'm going to visualize the anterior chest. Okay, I'm going to percuss your chest. Good. Now can you say 99 for me?
99. 99. 99.
Good, and that's looking for tachyphragmatus. I'm going to come to the back, and I'm going to do that as well.
99. 99. 99. 99.
Good, thank you. You lower the back and keep the front up for me. I'm going to listen to your lungs now. Good, deep breaths through open mouth for me. And one more good deep breath on this side. This side. Good, no pain there?
No.
Good, okay. Now can I have you lay back on the bed here for me? Thank you. I'm going to visualize the chest wall. I'm looking for the point of maximum impulse, and that is going to be mid-clavicular line at about the 5th intercostal space. I'm going to palpate for that. Good. Okay, now I'm going to auscultate your lungs with the bellow and diaphragm in my stethoscope. I'm sorry, your heart. Okay, you can lower your shirt. I'm going to have you to turn your head that way for me, please. I'm looking for any jugular venous distension. Okay, and can you look this way for me? Good, now you can look forward. I'm going to look for the carotid impulse. Good, now I'm going to palpate the carotids. I'm going to auscultate the carotids with my bell of my stethoscope to listen for any bruit. Good. Now I'm going to move on to the abdominal assessment. If you'll raise your shirt, thank you. Okay, first I'm going to visualize the abdomen. I'm going to look for any raised area or areas of distension. Good, now I'm going to auscultate the abdomen. I'm going to listen in 4 spots with the diaphragm and then at the aorta and the iliac and renal arteries. Aorta may just above the abdomen or the umbilicus. Now I'm going to percuss the abdomen. I'm going to percuss in 4 quadrants. Suprapubic, navigastric. Good, any tenderness there? Okay, now I'm going to do light palpation. Is any of that painful? Okay, deep palpation. Anything tender? Okay, now I'm going to palpate for the liver, doing the hooking technique. Good. And I'm going to palpate for the spleen. Take a deep breath in. Good. Okay, and now I'm also going to percuss for the liver and the spleen. So I'm going to start low. Let me get my tape measure. Okay, I'm going to start below the umbilicus and I'm going to go midclavicular line and go up. Okay, and then I'm going to come down. Good. Good, I'm going to measure that in centimeters. That's 5.5 centimeters. Good. Now I'm going to percuss for the spleen. Good, take a deep breath and hold it for me. Good. Okay, now I'm going to place my hands in your groin. I'm going to palpate for the inguinal lymph nodes as well as your femoral pulse. You can lower your shirt. Okay. Good. Good. Now I'm going to palpate for your kidneys. So I'm going to place my hand behind. You take a deep breath. Go ahead and breathe out. Good, and a deep breath in. Good, and out. Good. I'm going to come around and do the other kidney. Good, out. Good. Any tenderness? Oh, good. Okay, you can lower your shirt. You'll set up for me. Okay. Do this. I'm going to now look at the fingers. Feel in the metacarpal joint and the metacarpal heads. Look at the wrist. I'm noting if both are equal. Good. I'm going to palpate the distal radius, distal ulna. Good. And I'm going to palpate for the radial pulse. Good. Now we're going to do range of motion. Can you open your fingers, tight fist? Good. Can you take your thumb and touch it by your pinky and roll it across? Back. Good. Can you touch each finger? Good. Put your wrist down, wrist up. Good. And then inversion and eversion, or ulnar radial deviation and ulnar deviation. Thank you. Okay. And then I'm going to do range of motion at the elbows. I'm going to have you flex. Good. Extend. Good. And then raise your arm up. You pronate, supinate. Good. Do this side. Good. 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 And then I'm going to feel for any epitrochlear nodes. Okay. Moving up to the shoulder, I'm going to find the acromion process. Okay. And the acromioclavicular joint. The distal head of the humerus. Feeling the scapula. Good. Good. Any tenderness there?
No.
Okay. I'm going to have you raise your hands straight out. Good. Can you put your hands up above your head and touch? Good. Behind your head. Good. And behind your back. Good. Okay, now we're going to test strength of your upper extremities. So I'm going to have you pull against me. Good. Push. Good. And then we're going to take your hands, and I want you to make a fist. And try to push your wrist against me. Just your wrist.
No.
Good. Good. Okay, and then I'm going to have you to take your hands and try to spread your fingers. Good. Now try to touch your pinkies to your thumb. Good. And then squeeze my fingers. Good. All right. Now we're going to go to the lower extremities. I'm going to inspect the feet. Looking at the metatarsals, palpating the 5 metatarsal heads. Looking at the ankles, testing for swelling. Good, no swelling. I'm going to find the dorsalis pedis pulse. And posterior tibial pulse. And I'm going to palpate the calcaneus. Good. I'm going to lower your legs. Okay. Can you raise your toes up? Good. Point your toes down. Good. Can you do inversion where you point your toes? Good. Eversion. Good. All right. Spread your toes. Good. All right. Now I'm going to come up to the knee. I'm going to palpate the medial femoral, the lateral femoral, the medial tibial plateau, the lateral tibial plateau, and the tibial tubercle. Good. And palpate the meniscus. And the medial collateral ligament. And the lateral collateral ligament. And those were the medial and lateral femoral condyles that I was palpating. Good. And I'm palpating the patella for any swelling. Raise your legs up. Good. Bend your legs back. Can you scoot closer to the end of the table? Bend your knees all the way back. Good. Now can you twist your knees in? Good. And then out. Good. All right, you can scoot back. I'm going to have you lay back on the table. Good. And I'm palpating for the anterior superior iliac spine, iliac crest, iliac tubercle, anterior superior iliac spine, or posterior superior iliac spine, the ischial tuberosity. And I'm going to have you move your leg. I'm feeling the greater trochanter. Good. And I'm going to do the same on this side. Any pain there?
No.
Okay. Okay, rotate your leg for the greater trochanter. Good. Okay, can you take your knees and pull them up to your chest for me? Pull them. Good. Any pain? Okay, you can straighten them. Okay. I'm going to take this leg and we're going to move it out. Good. And back in and across. Good. Okay, out. Good. So that's abduction and adduction. Abduction is out, adduction is in. And then I'm going to bend you, and we're going to rotate and do rotation. Good. Any pain? Just support the thigh. Good. No pain? Good. Okay, you put your legs down. Okay, you can sit up for me. Okay, we're going to begin the neurological part of the exam, okay? So what I want you to do is I want you to tell me your name.
Iona Rudolph.
Do you know where you are?
I'm at the health complex.
Good. Do you know what year it is?
2018.
Good. So your language was fluent and comprehensible, so that's good. I'm going to tell you some words to begin with, okay? And I want you to remember those words for me at the end, okay? All right. Brown table.
Brown table.
White ceiling.
White ceiling.
And gray dog.
Gray dog.
Okay. Thank you for repeating those. And I'll ask you those again at the end of the exam. Okay. All right. So let's see. I'm going to draw a square here on a piece of paper. And I want you to redraw that same square for me.
Okay.
Can you draw that cube for me, please? And this is testing your visuospatial reasoning. Okay. And then if I told you that people that lived in glass houses shouldn't throw rocks, why do you believe that is?
Because the house is made of glass and will break.
Yeah. Good. All right. So now I'm going to test sharp and dull. Okay. So I'm going to poke you if you'll close your eyes and tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. 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 Sharp.
Good. Now keep your eyes closed for me. Does this feel the same as this?
No.
Okay. Okay, I'm going to gently touch you with a cotton if you'll close your eyes and tell me if you feel it.
Yes. 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 Yes.
Good. Okay, we're going to do some rapid alternating movements. So I'm going to have you do is I'm going to have you take your hands and slap them on your lap as fast as you can. Good. And take your feet, and I want you to tap your toes to my hands as fast as you can, alternating.
Oh.
Good. Good. Okay, now I'm going to have you take this hand, and I want you to touch your nose and then touch my finger, okay? Good. Now can you do the other hand? Good. Now I want you to take this heel, touch it to your knee, and come all the way down to your big toe. And back.
Oh, back up.
Yes. Mm-hmm. And the other leg. Good. Now I'm going to get my reflex hammer and I'm going to test your reflexes. I'm going to do the brachial. Good. Sorry. Good. The radial. Brachioradialis. Good. And the patellar. Good. Good. I'm going to do the Achilles. Good. And I'm going to test for the Babinski reflex, okay?
Mm-hmm.
Good. And there is no, your toes do not go in. That's good. Good. Okay. Can you stand up for me? All right. I'm going to observe your gait, so if you'll walk that way for me. Good. Now, when you walk back to me, can you walk heel to toe?
Maybe. Like one in front of the other?
Yes, ma'am.
Like a little overdone.
Good. Okay. Now, can you walk that way on your toes? Good. And walk back this way on your heels.
That's what I thought heel to toe meant.
Good. Okay, and now I'm going to have you place your feet together.
Okay.
Okay, and close your eyes. We're going to stand there for 20 seconds, okay? Good. Okay, now if you'll stay standing, I'm going to have you to lean forward and touch your toes. Good. Now I'm going to place my hand on your lower back for support. Can you lean backwards? Good. Now can you lean from side to side? Good. Any pain?
No.
Okay. Now what were the 3 words that I asked you to remember?
Brown table, white ceiling, gray dog.
Good. Thank you.